be doing a speech about the history of nursing. First, I'm going to start off with a quote by Florence Nightingale, who is the founder of modern nursing. Nursing is an art. If it is to be made an art, it requires as exclusive a devotion, as hard a preparation, as any painter or sculptor's work. A nurse is someone that I'm sure everyone has seen, even if from just going to the doctor, to going to the hospital, or just giving blood. The nurse is of vital importance in our healthcare system. They are the advocates of their patient, and I'm sure none of y'all are sure, or I'm sure that not everybody knows, their presence, job duties, and images have not always been what they are today. I started the nursing program at Faulkner State this past January. I knew that I always wanted to be a nurse, but I wasn't exactly sure what it all pertained. And I definitely did not know all about the history of nursing. And so I'm going to start off or give y'all 3 points about nursing history. First, I'm going to talk about the different images that nurses have had. I'm going to also talk about their job titles and how they've changed within the healthcare system, and different people or important nurses that have been a part of building the foundation for nursing as it is today. And there's the quote by Florence Nightingale. And my 3 main points about the nursing history. But now I'm going to start off with the different images of nursing. First, nurses were known as like an angel. They were perceived with a halo or some kind of significant religious symbol that had to do with their name if it was posted on anything, like the picture here with the nurse with the angel wings in the middle of war. The reason that is because most of nursing started out with having to be oriented towards religion. They started out in a church, and most of the time it was a priest or a priestess that took care of all the sick and the ill. And they used anything from physical care to prayer or magic spells to fix the ill. Also, nursing is still, or religion is still important in nursing today. And then another face that nurses had was a handmaiden, where they were seen as the servants for physicians. They were seen as only as the right hand, or not even the right hand man to the physician. They were used to fetch this, fetch that, or do this or do that. They were never used as their own entity. Within the last few years, nurses have gotten where they can now pursue a further career in nursing in order to be more independent. Another image would be, as everyone has seen in Halloween costumes, would be the naughty nurse. And then there's also the battle axe, or nurses are known as a torturer or abuser. And that is seen in the One Flew Over the Cuckoo's Nest as Nurse Ratched. Then also nurses were seen as heroes on the battlefield. They were the ones that took care of the wounded, or were seen, off of the battlefield in tents taking care of the wounded. Now that I've gone over some of the images of nurses, I'm going to go over how their duties have changed. As I had mentioned earlier, nurses were seen as the handmaiden. Well, that was how we all started out. We were seen as the person that tended to the physician instead of the actual patient. And we were meant to stand in the physician's presence. I remember a story from my first semester from my teacher, Miss King. She told me one of her first jobs that she got in trouble by a doctor because when the doctor entered the room, she was sitting at the computer, charting on the computer, and the physician didn't act like anything was mad until he reported to the charge nurse that she didn't stand in his presence. And of course, it's changed. Now nurses have a more independent, more vital starting IVs to giving medication, taking vital signs, and all of this is for us to report back to the physician without having to have them actually perform it. Also, the nurse is seen as the direct care provider. We provide needs for our patient for anywhere from being there physically, emotionally, socially, to spiritually. We're also their communicator, educator, and advocate. And then one of our main jobs is to always educate them, take care of the patient. And as I said earlier, the nurses have changed in order to go back to school and get a master's degree or a doctorate degree where we can take care of them without even having to report back to the physician. Well, now that I've discussed how the roles have changed and how the images have changed, I'm going to tell you about the different influential people within nursing. The first one that I mentioned in the beginning, I used one of her quotes, was Florence Nightingale. She's the founder of how modern day medicine is. She decided that air, light, nutrition, and adequate ventilation and space would be beneficial to a patient's recovery. Once she initiated her beliefs, there were findings in hospitals that decreased mortality rates, decreased length of stay, and decreased healthcare associated infections, which is any kind of disease from like a UTI or getting pneumonia, which is most of the time something that you acquire that you can acquire, that we most of the time try to prevent you from acquiring in the hospital. Not only with Florence Nightingale, there was Claire Barton. She was one of the nurses that gave care during the war, and she cared for wounded soldiers not only on the outskirts of the war, but she also cared for them directly on the battlefield. She wanted to make sure they got care immediately. And when she got done with serving in the war, she established the American Red Cross, which we all know of today. And it's not only where you donate blood, they help everybody in crises. Two nurses that founded something together was Lillian Wald and Mary Brewster. They were the ones that established measures for community health care. They were the founders of Henry Street Settlement. And they used this to help improve community health by improving sanitation, providing safe drinking water, and better sewage facilities for communities. And this influenced where there wasn't as many infections or diseases that were happening within the community. Now that I've given you a brief preview of the nursing history, I'm going to conclude my speech. First, with reviewing the three different points, knowing that I went over the different images that nurses have seen, anything from being the naughty nurse to just the handmaiden for the physician, to their duties within the healthcare field and how it's advanced to what it is today, and how now we can do everything, or a lot of things, on our own. The third was all the different